Feeling lost in the world of dental implants? Wonder if they're the perfect solution for your smile? Step into clarity with one of the top dentists in Chandigarh, Dr. Rahul, member of the Association of Oral and Maxillofacial Surgeons of India and the Indian Dental Association. Don't let confusion hold you back.
As you know, there are 32 teeth. Each of them has its own roots and support system. But when a patient loses all their teeth, it's not really necessary to replace each tooth with a single implant. Research has shown us that select number of implants which are appropriately placed in the bone with the correct physics and the correct transmission of forces provide sufficient support for a denture system or prosthesis as it is known, which can be aesthetically and functionally complete. And this led to the discovery of what is known now as the all-on-4 or the all-on-6 system, whereas implants are strategically placed in the upper and lower jaw. There may be 2 or 3 on each side. So that's where the concept of 4 or 6 comes up. And the prosthetic component is then attached to all of these. So they act as 4 pillars on which the prosthetic unit or the denture unit is stabilized. So when you look at an implant in this model and right here also, so basically these are screws made out of surgical titanium. Now why that material is used is because titanium is extremely biocompatible, which means that it allows the bone to grow on it. When you place a simple screw in the wood, it tends to tighten because of friction. Bone itself is a living thing, it's a living organism. So the bone tends to grow onto the implant. And that is what is known as, in technical terms, osseointegration. The implant gets integrated with the bone and that allows it to function for a lifetime under different kinds of stress, strain and loads while you're eating and chewing. And the number of implants basically is determined by many factors. The most important factor actually is the denture part itself, or the prosthetic part. So when we see the status of the patient's jaw, we have to decide what kind of a denture the patient needs. And then we backtrack or do reverse engineering to determine how many implants would be ideal for that patient. Secondly, it also depends on the type of bone, the quality of bone, and the availability of bone in which we can place implants. Sometimes depending on the anatomy of each individual patients, if we need more support in the posterior part, then we might have to add an implant. If we don't need that, we might be able to do without it. And that all these factors together, as I said, initially it's the prosthetic planning. After that, all those factors together determine the ideal number of implants for that patient.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.